we're presenting on multiple sclerosis. Floor is yours.
Alright, so has anyone heard of multiple sclerosis? Show of hands. Yeah. Oh my gosh. Are you serious?
I don't know what it is.
Wow, that's so awesome. Does anyone know like what it is, or any like side effects or anything that you want to share? Yeah, go ahead.
I've treated an MS patient with an occupational therapist.
Oh my goodness, that's
That's
what kind of symptoms did they experience?
Well, she had to go in, she was 45 and living in a nursing home because she was in the later stages of multiple sclerosis, so she could talk very well, and she was completely immobilized, so she was kind of at the extreme end of having MS.
Yeah.
And we did a lot for her contractures in her hands where she couldn't open her hands, and she had to have a thumb amputated because she cut off circulation by holding it, and so she had to have that amputated so that it wouldn't, die. So we worked on keeping her hands open and making sure her limbs moved as much as we could.
It's cool.
I had a coach for martial arts habit, and so they went from having being really fit and active, and to she would come to practice and she still wanted to wear her gi, but she could barely move, and it was just really sad. She trained for the Olympics, and so she went from one extreme to
Alright, so MS is basically an immune disease that affects your CNS, which is your central nervous system, and so it does damage to your myelin sheath, and your myelin sheath is the coating of your nerve or your axon attached to your cell body. It serves as an insulated protection and aids in transmitting information to your brain, your spinal cord, and your other nerves in your body. So you get that communication in your body on what to do. So moving and things like that, so motor movements. And then also does damage to your oligodendrocytes, and that is in charge of myelination in your central nervous system, and so that makes myelin for your cells and things like that. And then also MS affects nerve fibers in your body as well. And so basically the immune system causes inflammation in your central nervous system that then does damage to, like I said, the myelin sheath, oligodendrocytes in your nerve fibers. And one interesting tidbit, the reason why we kind of call multiple sclerosis, well, the reason why we gave it its name, bless you, is because when your myelin is damaged, you have this scar tissue, and so you have multiple areas of scarring. So multiple sclerosis, kind of, but sclerosis. So yeah, anyways. I thought that was funny. Alright, so fun time. So if everybody can stand up, that'd be great. We kind of did this activity in neuroscience, so thank you, Dr. Blunt. And then everyone's going to stand in a circle. And you're going to hold hands. Yeah. So, yeah, everyone hold hands. Alright, so I'm going to give you instructions. So I'm going to tap Lindsay, and Lindsay is going to squeeze Jordan's hand. Jordan, you're going to squeeze Kat's hand, and then we're just going to go around, and then we'll come back for the second part of the activity. So I'll touch you. Oh. And then Alright, so I'm going to break the communication. Woo-woo. And so I'll touch you again, and then you'll pass that around. Alright! Oh my goodness, I didn't connect to Lindsay. Wow! Everyone can sit back down. I was like, oh, did I do anything? Alrighty, so in that activity, I kind of wanted to demonstrate what your body normally does. Cells are interacting so that they can send messages to your brain and your spinal cord, so you can move and do other things with your body. But if myelin is damaged, then therefore you have a break in communication, and so messages aren't being able to send to your spinal cord or your brain or things like that in your body, so your body can do the things that it does. And so one of the big factors of multiple sclerosis, or MS, I'm going to try to say that for the rest of the presentation, are T cells. And T cells are white blood cells. You have your B cells and then you have your T cells. And your T cells are the white blood cells that attack like all the bad stuff, all the bacteria, and viruses and tissues and things like that. And then you have 3 different kinds of T cells. You have the helper T cell, you have the regulatory T cell, and then you have the killer T cell. And the helper T cell recognizes like foreign antibodies and activates other T cells to go and get the bad stuff through the process of cytokines. And then you have regulatory T cells that basically turn off the response of the immune system. And then you have killer T cells, and these are the feisty little T cells that attack and destroy the bad cells in your body, so you are healthy and not sick. Amen. That's always good. So on the last slide, I had a point that said there's no like cause for MS particularly, as far as I know and research has shown. But there are like kind of theories and factors that kind of play into MS, such as genetic factors, environmental factors, and things in regards to your diet. And so there has been research shown that, like, not shown, but providing evidence that some genes may affect your body and cause you to have multiple sclerosis. And there have been a lot of studies done in like twins and things like that. And this cell right here has been kind of, what's it called? And then what's the word? Geez Louise. Yeah, this cell right here has been researched on and basically has been tested to see whether that causes MS or things like that. But yeah, and so there's this hygiene hypothesis as well. Basically that states that when like people are growing up, they're susceptible to certain types of diseases, and that correlates to like your the learned hygiene that you may like get taught by your parents and things like that. And then, like I said, diet kind of plays into effect and maybe a factor of MS. So like obesity, getting enough vitamin D, and our like Western diet kind of correlates with like an increase in autoimmune diseases. So eating like high caloric fat and a lot of red meat in your diet isn't really good. Alrighty. And this video kind of just recaps like everything I said, and yeah, let's watch it. Oh, shucky ducky.
Multiple sclerosis is a disease that impacts the brain and spinal cord, which make up the central nervous system that controls everything we do, whether it's taking a physical step or solving a complex problem. The exact cause of MS is unknown, but we do know that something triggers the immune system to attack the brain and spinal cord. The resulting damage to myelin that insulates wire-like nerve fibers is a disruption of signals to and from the brain. This interruption of communication signals causes unpredictable symptoms such as numbness, tingling, mood changes, memory problems, pain, fatigue, blindness, or paralysis. Everyone's experience with MS is different, and these losses may be temporary or long-lasting. Most people initially have relapsing remitting MS, where they experience attacks of new symptoms followed by periods of time when those symptoms go away partially or completely. Others experience gradual and ongoing loss of function without distinct attacks, which is known as progressive MS. MS can be difficult to diagnose, but once a diagnosis is confirmed by a neurologist who is knowledgeable about MS, there are disease-modifying therapies for reducing attacks and slowing down the damage. Growing evidence suggests that early and ongoing treatment with a disease-modifying therapy is an important defense against future attacks. There are also treatment strategies to address some MS symptoms. Options are still limited for slowing down or stopping progressive MS. Worldwide research is accelerating the discovery of how to slow down or even stop progressive MS, how to repair nervous system damage and restore function, wellness strategies such as exercise and diet that can help people with MS to live their best lives, and the exact cause of MS so that it may be prevented for future generations. To learn more about multiple sclerosis, connect with others to drive research for a cure, and to address the challenges of everyone affected by MS, visit nationalmssociety.org or call 1-800-34...
So, we found 4 different types of MS. The first one is clinically isolated syndrome, relapsing remitting multiple sclerosis, RMS, secondary progressive multiple sclerosis, and primary progressive. So, clinically isolated syndrome, CSI, is the first episode of neurological symptoms. It is caused by inflammation in the CNS, the central nervous system. It must last at least 24 hours. And it is 2 to 3 times more common in women than men. There's a high risk development of CSI that is accompanied by a lesion on the brain when people go through or get MRIs done. And when they find a lesion on the brain, it's similar to those seen in MS. And then the low risk development, about 20%, there's about a 20% chance of developing MS in the same time period, even if a brain lesion is not found when the MRI is done. So the second one, relapsing remitting MS. This is the most common type of MS. It attacks called relapses of new or increasing neurologic symptoms. There are periods of partial or complete recovery follow the attacks. Relapsing remitting is the inflammatory attacks on the myelin sheath and the nerve fibers. The active immune cells cause localized damage. And then since location varies, no 2 people experience the same symptoms. There was a quote that I found that said approximately 85% of people with MS are initially diagnosed with RMS. And so during these inflammatory attacks, activated immune cells cause small localized areas of damage which produce the symptoms of MS. And because the location of the damage is so variable, no 2 people have exactly the same symptoms. The third type of MS is secondary progressive MS, which occurs in people who initially experience the relapse remitting MS. Therefore, it's the second phase of the disease in many individuals, and the neurological symptoms often worsen over time, and the disability escalates. And the last type of MS is primary progressive MS, and for about 15% of people with MS, PPMS is the first and only phase that they experience. Neurological symptoms often worsen without early relapse or remission, and they tend to have fewer brain lesions as a result of lesser inflammation.
Alrighty, so Michaela kind of touched on this before when she was explaining the different phases of MS, but symptoms vary and the content of MS vary, and they're contingent upon the person depending on where the damage and when the damage has occurred in the myelin. And so there has been a diagnostic system to kind of diagnose MS, and we'll kind of get to that later. But you have to have at least like 2 symptoms and then that occur at different times. So these are kind of like common symptoms of MS. So you have like fatigue, numbness or tingling, spasticity. Sorry about the babbling, I don't know what happened to that. Dizziness and vertigo, cognitive changes and things like that. And the second slide kind of just goes over like not as common symptoms of MS, so like speech problems, swallowing problems, tremors, itching, hearing loss. Sorry about that. So the McDonald criteria for the diagnosis of multiple sclerosis is the current diagnostic criteria of MS. And so this has been revised last year, and it was revised from the 2010 criteria for MS. And so yeah, that's really cool. It is really hard to diagnosed because it's similar to other diseases, which I can't think of right now. But a lot of people get misdiagnosed because it's very similar to other diseases. And I thought this was interesting. Sleep, it's coming back again. Woo woo. All right, so I found this quote. The prevalence of sleep problems in multiple sclerosis is significantly higher than in the general population, which I don't really find that surprising, but I thought I just wanted to put that in there because sleep is important for everyone.
So, when doing research for multiple sclerosis, I thought about its effects on driving because, because the disease is affects your central nervous system. I just figured driving would be an important part, and because you drive a lot day to day or whatever. So driving performance is affected by symptoms of MS such as muscle stiffness or spasms, and then other effects include fatigue, delayed reaction time, loss of feeling in your hands and your feet, seizures, loss of consciousness, blurred vision, loss of color vision or double vision. And I actually found this on a brochure about driving in MS, and I thought these were interesting effects of MS because, I thought it was interesting because you need obviously you need your hands and your feet to drive. You need to be able to see, and the fact that those things are the major things that happen just blew my mind because I just thought it was very interesting. And then it also said that there are medications that can also affect your driving skills. The medications you take for MS can also have an effect on your driving performance.
So, I have a question. So, when you go and get, your license renewed and they ask, do you wear, glasses and all that stuff, do you have to, tell them that you have multiple sclerosis? Can they keep you from driving because you're diagnosed with that?
So, if I may answer. So, what I read, when I was going through the brochure, what I read is that, often, they don't, it's not necessarily required that you tell them, but because then, if you tell them, you're most likely won't get your license, so you have to do a whole bunch of other things, which I'll talk about later, before you can actually get your license. And so, so I don't think it's necessarily required that you tell them, but it would be, in your best interest to tell them. I know, this is not dealing with MS, but for my seizures, I couldn't get my license for a long time because I have seizures, and then, they happened while I was driving, so that was good. Driving in MS continued. Ways to ease difficulties of driving with MS was mechanical hand controls to operate the brakes and the gas in your car, a spinner knob to help you turn the steering wheel, wide angle rear view mirrors, and then large outside driver and passenger side mirrors help you see. And then there are specialized seats to help you to make getting in and out of a vehicle easier. The next slide is just pictures of what that kind of looks like. This is the knobs to help turn the wheel, and then you can obviously see there's a lot going on in the car, which I feel has, when driving or whatever, just all the stuff that you have to do just to be able to get from point A to point B has, I feel has a great effect on you, psychologically and just everything like that.
All right, treatments for MS. There are a lot of treatments, and Hannah, it was cool that you got to, what did you do again?
We did augmentation.
There we go. It was cool that you kind of got to experience that. So as of right now, in the research that I've done, MS isn't a curable disease, so they don't have a cure for MS. But there is research done now to effectively try to repair myelin, so whether that's through drug testing or things like that, and then getting more research on T cells to figure out how we can, combat MS. Do that. There's also a treatment technique called CAM, which is complementary and alternative medications, and it's more so becoming a holistic person, and so they focus more on exercising and a balanced diet, stress management, and coping skills. And acupuncture was said to be something that may be helpful for some patients, but not all. Two of the treatments that I found that were really interesting were using low doses of naltrexone. A study was done to research the effects of low dose in naltrexone. So if you use a lot, obviously that's not good for your body, but if you use low doses, it's good, especially for those who have, for those who have MS and to reduce some of their symptoms. There has been there's been limited research done on this particular drug. But when I was looking up different articles, there was one trial done on 40 patients with PPMS, and the trial was deemed safe and did not affect the quality of life for patients, because ultimately, if you have MS, your life can be affected in some way, whether that's socially, psychologically, and things like that. Just talking about the biosocial model. And so what naltrexone is, it's an opioid antagonist, so it blocks opioid receptors. And it's usually taken for a prevention of alcohol relapse, but in this case, it's used to relieve pain that some MS patients might have. And it also can be used to treat other symptoms of different other diseases, such as certain types of cancers and things like that. Also, cannabis can be possibly used, but it's kind of controversial right now because there's still research being done, and it's mainly controversial because of the side effects, more so cognitive functioning. And so I saw that a study was done on the effects of cannabis in cognition. 20 participants smoked cannabis and 19 participants did not. And they were asked to complete a working memory task, an auditory task, and things to that nature while undergoing an fMRI, and it resulted in the cannabis group performing poorly on memory task and auditory task. And so this is one of the reasons why that people probably are against using cannabis, because of the low cognition task and things like that.
These people with MS, just
Yes, with MS.
that's fascinating that you found a study like that. Very
Yeah.
timely.
And so there are a lot of drugs used to treat MS if you choose to go that route, and you don't choose to do the holistic thing route. So there's injectable drugs, oral, and infused, and each of these, since MS varies upon the person, there's a lot of different medications that you can take for the symptoms that you're experiencing. And it's not really to cure your symptoms, but it's to treat and relieve your symptoms more so.
Okay, so pregnancy. I thought that, so when I was researching, I thought about pregnancy since MS is 2 to 3 times more common in women than men. I thought that this would be an important thing to know as a woman, especially if you end up having MS or you know someone that has MS. So surprisingly, the symptoms often decrease during pregnancy and then they increase after delivery. It doesn't appear to worsen the effects of MS, but it may make it physically hard to carry during pregnancy. The likelihood of falls increases due to muscle weakness and difficulties with coordination. But there's no direct evidence that MS causes infertility, which I thought was interesting. Pregnancy, delivery, and birth rates aren't significantly different compared to women without MS. And then, but women who are pregnant with MS may need to have more prenatal visits, and definitely family and other support systems help a lot during that time. And then, so some things that you could do while pregnant to help you with that is adapting your home environment, and then reestablishing your motor skills.
We're kind of just going to watch a video of a guy explaining his story of MS. And this is just one perspective of what MS is to him. Like I said before, MS is different for so many people, and not 2 people share the same symptoms. So let's see if Oh, shit.
So I've been watching just a ton of these My MS Story videos, and it's been hard for me, but I'm going to try to make my own. This is, I have to say, about the third take on this, just because it's just hard to talk about. But I'm going to do it just because these My MS Story videos are just so awesome. I've been watching so many of them by different people out there, and there's so many things I connect with, and then also things I've just never even heard of, and that just kind of blows me away. So anyway, here's my MS story. I am 45 years old, and I've had MS for about 17 years, at least symptoms of MS for about 17 years. But I've known that I've had MS for 3 months now. So it's all pretty fresh in terms of knowing that I have MS, but the experience is just like a long-standing thing through almost 2 decades, 17 years of my life. So here's how that happened. I started having pretty minor kind of peripheral numbness and tingling in my late 20s. My feet went numb one time for 2-3 months, and I just kind of thought it was weird to talk to people. My butt went numb for a couple months. I thought it was because I was sitting too much or something. You know, people's butts go numb. Anyway, it was about 10 years ago that I first saw a doctor for these things when my arm went numb. And I was thinking, well, my arm, you know, it's a little more serious. So I went and checked that out, and the doctor thought I had muscle spasms and gave me some acupressure stuff to do, and that was that. And again, it was a few more years after that, 5 years after that, that I got double vision. And that's when it just got kind of serious. You know, a lot of MS symptoms start with eye problems, and I've seen that in a lot of videos and read that in the literature and whatnot. So I got double vision. It was a partial palsy of the 5th cranial nerve, which basically leads to diplopia or double vision on one side. So my right eye, this eye, just couldn't go all the way to the right. So I'd look to the right and I'd see all kinds of crazy doubling, and I'd look to the left and things would be okay. So I just looked to the left for a while, and I was doing pretty good. Made it through. I did see a doctor, and they did all kinds of blood tests. Did a brain scan. Brain scan came up clear. Blood test came up pretty good. I had a little white blood count, but other than that, I was doing pretty good. And at that point, you know, there was some mention, well, you know, MS is one of the things it could be. It could be lupus, and it could be Lyme disease, and all these things. So anyway, that got better after a couple months, and I just kind of went on my way. And it was actually a couple years until I started having some pretty pronounced numbness and tingling in my legs, usually my right leg, right foot, and then also this crazy thing of numbness and tingling, and then also hypersensitivity. So like if I walked on carpet, it was like walking on a bed of nails or glass shards or something. So really, really sensitive, also numb, and then also like crazy cold, hot sensation. So it would feel like if I touched a cold wood floor with my right leg, it would just feel like I was stepping a block of ice. So sometimes I would go to the doctor for this, and sometimes I would just kind of just let it roll. But I saw a couple neurologists, and actually I saw one neurologist, neuro-ophthalmologist, and she looked at my brain scan. She did multiple brain scans over time, and said, absolutely, Spencer, you do not have MS. And this is a rheumatic disease of some kind, or it's idiopathic, meaning no known cause. So I just kind of took that like, okay, at least it's not MS. I got no lesions in the brain. I'm good. I just got some other weird thing, and I seem to be doing okay. I just get this numbness and tingling and pain. And so I had various symptoms. If you look at my MS story over those 17 years, I had a couple symptoms divided by many years at the beginning. And then in the recent years, 5 years, it would be like more like multiple exacerbations each year, usually in the spring and summertime, as is common with a lot of folks. Probably due to vitamin D going down and heat going up and whatnot, and activity for me going up a lot in the summertime. This past year, I had some more numbness and tingling in my legs, different sides of the legs, and I went to see a specialist down in St. Louis at an MS clinic. And it did not take her long to figure out that I had MS. She did a spinal tap, which for me was really, really difficult, like crazy difficult. And I'm not going to say a whole lot about that. Some people have good experience with spinal tap, and for me the lumbar puncture was rough. In the end, I was glad I did it. I found from that it was looking pretty positive. You know, I had multiple bands and whatnot. and the blood-brain barrier had been breached. There's blood in my spinal fluid. And then she went ahead and did a scan, CT scan? No, MRI of my spine. And the spine showed just a ton of lesions. So it turns out that I've got MS pretty active on my spinal cord. Obviously in the head too, since I've had eye problems. Since then I've had 2 bouts of optic neuritis, which is, like loss of color vision and all kinds of cloudy, messed up stuff. And then also eye pain. I had one in the right eye, one in the left eye. So I've had some eye stuff, but otherwise my mobility is really good. I've been posting these videos about staying strong with MS, just to say, if you get to high JC, you're likely to get that crazy brain infection. And I'm not really into brain infections, so I have the end of my story so far. I've talked to a few people who've been on the drugs, been on different drugs or the same drug for a while, and I've talked to some people who've not. I talked with a gal, a family friend in California, Sharon, and she's had MS for 40 years, so twice as long as I have. And she's not on the drugs, and she's doing pretty well. She's a swank diet person. I know a lot of people are on the Walls diet. There are a lot of folks with MS, I think, I've seen, who are kind of treating it or attacking MS with deliberate forms of diet, exercise, rest, low stress, activity, and exposure to heat and cold and that kind of thing. So I'm trying to sort of think about the way that I've had MS for 17 years, and I'm actually doing pretty well. I think in part because I'm an active person, maybe I'm just lucky.
Alright, we can stop it at that. And so with that video, I kind of just wanted to give you guys a perspective of like what a person with MS has. So we're going to kind of just talk about the biopsychosocial model. So we'll put biopsycho and psychological up here. That's it, right? And then you guys can come up and write like different ways that MS will affect these different things. Here you go. Have fun. Okay, cool, sweet.
I didn't really know what it was either, but I always tell I would always see the commercials of people the pictures that they tell their bag and then done into their hands and I would always see those commercials, but I didn't really. So what made you choose this topic? I think someone else was murder. I looked at I think we did 5 different. So I'm really happy to